I'm Pat Murphy-Stark. Welcome to MDTV Medical News Now, a program dedicated to bringing you leaders in the field of healthcare. Our show strives to give you the latest information about new techniques and treatments in the field of medicine. In the time prior to breast implants, plastic surgeons were often called upon to provide solutions for breast deformities, perhaps resulting from birth abnormalities or from the treatment of cancer. From this experience grew a much better understanding of breast surgery in general. Plastic surgeons developed techniques and materials that served to enhance the appearance of breasts that were perhaps small, sagging, or of different sizes, but otherwise normal. Today, breast augmentation is the third most requested cosmetic procedure, following liposuction and facial procedures. Determining placement of the implant leaves two choices, either on top or below the chest muscle. Each has its own advantages. Placement above muscle gives the breast a more natural appearance, since this is where natural breast tissue is located. Placement below the muscle provides a layer of camouflage, hiding any rippling that may occur on the surface of the implant. Factors that determine the best placement include age, lifestyle, and body type. The ideal candidate for breast augmentation is mature, healthy, and realistic in her expectations. Doctors stress that it is important for candidates to want to improve their look rather than hoping for the perfect figure. Among women who have had breast augmentation, the satisfaction rate is very high. Technology plays a significant role during the breast augmentation procedure itself. As medical reporter Sean Doran tells us, advancements in the tools of the plastic surgeon contribute the best possible result. That's the focus of today's MDTV Medical Moment.
Breakthroughs in the miniaturization of computers for the NASA space program had an impact in areas that far exceeded that of space travel. The same can be said for breakthroughs in the field of medicine. New technology often finds uses in areas different from that for which it was originally intended.
A perfect example is the endoscope. The endoscope can be accurately described as a tiny tube containing light-conducting glass-like fibers. The purpose of the endoscope is to allow doctors to see inside the human body for surgical procedures without the need for a large incision. Endoscopes have been used for procedures including those of the knee and other joints, the gallbladder, throat, nose, and colon. Today, the endoscope is finding its place in cosmetic procedures as well. Some of these applications include procedures of the forehead, face, abdomen, and breasts. Although the purpose of using the endoscope still remains to allow the doctor to see what he or she is doing during the surgery, there is an indirect benefit that ties in quite naturally with cosmetic medicine. Of course, that is the minimization of scarring made possible by smaller incisions. Also, doctors are able to make incisions in areas that are hidden and several inches away from the area being operated on for insertion of the endoscope. If you would like to know more about endoscopic plastic surgery and other cosmetic procedures, the board-certified plastic surgeon is your best resource.
I'm Sean Doran reporting for Medical News Now, and this has been your MDTV Medical Moment. Any questions or comments, please call toll-free 1-877-MDTV-NOW. That is 1-877-638-8669.
We've just seen how the endoscope helps to minimize scarring in the breast augmentation procedure. To talk more on that subject is our guest, Dr. Zachary Gerut, a board-certified plastic surgeon from New York. Dr. Gerut dedicates his practice to cosmetic procedures, including the no visible scar breast augmentation. Welcome to the show, Doctor.
Pleasure to be here, Pat. Thank you.
Well, you've obviously addressed one of the main concerns that women have is they don't want to have scars. What other types of things should they be concerned about to get the safest and the best possible results?
Well, patients should always be sure that their surgeon that they intend to have do the surgery is a board-certified surgeon, and this can be checked on easily with various organizational phone numbers. It's important to know that if your surgery is going to be done in a doctor's office, the doctor should have privileges to do this operation in the hospital. Other than that, patients should inquire about anesthesia because it's important to know who is going to be giving you that critical medication during the operation, as well as who makes the implant they're going to receive. Patients should be given a card that has all the information about their implants on it by their surgeon. In addition, the patient should have some knowledge of the surgeon through a referral by another physician or perhaps by friends or relatives who've used this surgeon in the past.
What would you say is the best route for inserting the implants? Because I know I've heard of many different options of getting it in there.
Well, each doctor has his or her own preference. My priorities when choosing the incision are based upon the patient's individual anatomy. Of course, if there are any scars present on the breast or around the breast before my surgery. There are other procedures that can be done in conjunction with breast implant surgery that offer access to the pocket that you need to put the implant into. But most importantly, for a patient who's never had surgery of the breast, there are 4 possibilities: under the breast, around the nipple, under the arm, and through the belly button. My preference is under the arm because it involves placing absolutely no scar on the breast, but I have the ability to place the breast implant under the muscle, which I believe to be the better position for it, as well as to control the operation endoscopically so that I can see everything that I'm doing, controlling the bleeding as well as the surgery as it progresses.
How about the size of the implant? Because I know there's a whole array of sizes out there. How do you determine it? What you should go with? Is it the person's choice that's coming to you that says, I want A, B, C, D, etc., or do you have to really take into consideration a lot of other things like their body type and if it would look proper or not?
Absolutely. Many things have to be taken into consideration. One of the most important things patients should understand is it's not possible for them to choose a letter. If you took a 32 brassiere, 32C for example, and a 36C brassiere, those 2 cups would be completely different. So if a patient shows a surgeon in a picture of what they want their breast to look like, that does not necessarily have anything to do with the patient's result because the body shape and size can be completely different, and therefore it's an irrelevant piece of information. I prefer that if my patients have been pregnant in the past and they've had an enlargement of their breasts, they can use that as a guide as to what they'd like to have because they had it once and perhaps would like it back. Patients who've never experienced that can choose a size based upon inserting items into their bra and show me exactly what size they'd like to be.
How long do they last? That's something I've always wondered.
Well, patients have an idea that the breast implants will last forever. Unfortunately, because it's a man-made and therefore imperfect by nature device, it's not going to last forever. Most patients understand, because they've been told and should be told, that the breast implants, by virtue of the manufacturer's specifications, are thought to last 20 years. Somewhere around 20 years after their surgery, the patient should expect to have to replace the implants. This may seem like something that is distasteful. However, if patients just stop to think, let's see, it'll be the year 2019 before I need to switch, you can put that into perspective. It's not an overburdening responsibility to know that for your future. Besides that, 20 years from now, there'll be much better breast implants available, feeling better, as well as more durable, and most patients will want to switch.
Now, I understand that you brought some before and after shots with you. Could we take a look at those?
Absolutely. This is a typical example of a patient of mine who's had breast implant surgery. On the before picture, you can see someone who has small breasts, tight skin, there's no drooping of the breast. And in the after picture, it's a larger breast, larger as per the specifications of the patient, with obviously no visible scar whatsoever on the breast.
Before we go to break, if you would like more information about breast augmentation or related procedures, you can reach Dr. Gerut's New York-based offices at 1-516-295-2100. Now, when we come back, we'll examine the battle to remain looking as young as you feel, and we'll give you some tactics that will give you the advantage. We'll be right back.
See the world run. Run, world, run.
Or with the American Express card.
Welcome back to MDTV Medical News Now. We all have something that we would like to change about our facial appearance. Perhaps you have crow's feet, the wrinkles around your eyes, or sagging cheeks and neck. Well, there are a number of different approaches to treating these problems. In addition to the aging process, external factors such as exposure to the sun, smoking, and pollutants cause the skin to lose its vigor and elasticity. Degradation of the skin's collagen and elastin fibers leads to the wrinkles and fine lines that give away our age, or even worse, make us appear older than we really are. To reverse the effects of aging, the board-certified plastic surgeon may turn to chemical peels or laser resurfacing. These procedures seek to stimulate the architecture of the collagen and elastin so that the healed skin has a more vibrant and youthful appearance. Now, when the ravages of age have left you with more than just small wrinkles and fine lines, a rhytidectomy, more commonly known as the facelift, may be for you. The facelift is a repositioning of the skin and deeper tissue of the face and neck. About 90% of facelifts performed in this country are done on patients over the age of 40. Oftentimes, a facelift is combined with other procedures, such as a forehead lift, an eyelid lift, and laser resurfacing in order to give the patient the most youthful, rejuvenated appearance possible. We're speaking with Dr. Zachary Gerut, a member of the prestigious American Society of Aesthetic Plastic Surgeons, whose practice is dedicated totally to cosmetic surgery and is certainly an expert on the topics of facelifts. Dr. Gerut, what can really be achieved during a facelift?
Well, the better answer to your question would be what can't be achieved with a facelift. With all modern technology that we have today, laser resurfacing, chemical peels, collagen injections, there are so many things that can be used for so many of the problems that make us appear older that we generally can take care of most of the things that bother a patient.
How has this procedure evolved over the years? How far has it come, and where is it really at right now?
Well, about 50 years ago, interestingly enough, there was a woman named Madame Noel who was doing facelift procedures in their infancy in the basement of a Paris apartment building.
Oh my goodness.
The French bun was the predecessor of her facelift, pulling the sides of the face back as tightly as possible. Since that time, we've come a bit of a way. The initial facelifts done in the 50s were pretty much skin operations, pulling the skin a bit tighter. In the 60s and 70s, doctors began to concentrate on the structures below the skin, tightening up the what we call fascial layers, which control the muscles and to some extent the fat of the face and the neck muscles. And recently, borrowing techniques from craniofacial reconstructive procedures where the bones of the face are rearranged, doctors can remove, literally, the entire soft tissues of the face from the bone and lift the face with a procedure called the subperiosteal facelift. All of these techniques put together and used judiciously on the proper patients for the proper reasons can yield fabulous results for the right kind of patient.
Does a patient need to take extra care after this procedure is done?
Well, there are many things that patients should and shouldn't do before and after a facelift. One of the things that immediately comes to the plastic surgeon's mind as far as the do's and don'ts is smoking. Smoking can ruin a good operation for sure. Most doctors will have a very, very important and very tight regimen of things of what should and shouldn't be done by the patient, both before and after the operation, and my best advice would be for the patients to follow their doctor's orders.
Now, I'm sure that immediately after surgery, a patient has got to be puffy. You've got to see that something was done. How long really does it take for a patient to look in the mirror and say, wow, I'm seeing some results here?
That's a good question. My patients are always asking me, doctor, when will I look good? I have to ask them a question back, to whom do you wish to look good to? I tell my patients between a week and 2 weeks after surgery, they'll be able to go places where no one knows them, and their faces will be puffy, but no one met them before this time, so they don't know their face is larger. Okay. As time goes on, the patients look better and better to different people, but generally they look good to themselves last. It takes quite a long time before a patient will look in the mirror, as you say, and say, wow, I'm really happy with this.
Okay. We're joined now by Barbara Gellerman, a patient of Dr. Gerut's, who's had facial rejuvenation performed at the doctor's Long Island, New York practice. Barbara, welcome to the show.
Thank you.
What exactly did you have done?
I had a lot of face work from Dr. Gerut, starting from either, let's see, I had a full brow lift, which also corrected my bridge of my nose. I had facial surgery, I don't know what you call it, here, my full neck. I had my lips made a little fuller, but not enormous.
How were the treatments? Was there a lot of pain involved?
Absolutely not. Absolutely not.
None?
I had one painkiller the first evening that I took only because I was afraid what might happen.
Well, now, what made you choose Dr. Gerut? That's what I would like to know.
When I might have been searching for someone, it started off very casually. I asked around. I'm an electrologist, and I asked one of my patients, she had other surgery, other body surgery from Dr. Gerut, but her mother had a facelift from him. And I spoke with the mother, and she got Dr. Gerut's name from her friend, who is a surgical nurse at a hospital. And that's always your best recommendation.
Sure. Doctor, what was Barbara's case, and exactly how did your treatments help, do you feel?
Barbara wanted to have a more youthful appearance to her forehead, and she wanted to have a more youthful appearance to her neck, and to remove all of the little, well, as little as it was, bit of sagging skin around the corners of her mouth and her cheeks. Oftentimes when I analyze a patient's face for rejuvenation, I find minor, very minor items that would benefit the patient, such as enlarging the lips, because lips very often do get smaller as we get older.
Right. What other less invasive procedures are available besides a facelift?
There are many people who, either because of their age or because of their fears, are not ready for a facelift. And for these people, there's a whole host of items they can make use of to get the little bit of touch-up, or however small procedure you want to call it, to look better and feel better. People who aren't ready for surgery can undergo collagen treatments, alloderm treatments, Botox injections, which selectively remove wrinkles from areas by paralyzing the muscles selectively. It isn't dangerous because you cannot overdose on these injections. There are various chemical peels and laser peels available of different depths to the skin. Therefore, the healing times vary tremendously, and patients should choose judiciously.
Well, Barbara, we appreciate you coming by to share your experiences with us today.
Thank you.
If you would like more information about facelifts and facial rejuvenation, you can call the American Society of Aesthetic Plastic Surgeons at 1-888-272-7711. Or you can reach Dr. Zachary Gerut and his staff at 1-516-295-2100. Now, when we return, we'll find out who's having rhinoplasties, what you need to consider, and we'll learn just what makes the ideal nose. We'll be right back. Welcome back to MDTV Medical News Now. Next to hair transplants, rhinoplasty, or aesthetic surgery of the nose, is the most popular cosmetic procedure with men, and the leading procedure performed in this country on people 34 years old and younger. In fact, there are three distinct profiles of people who seek out rhinoplasties. The first are the teenagers who prefer to begin adult life with confidence in their appearance. Next are young adults in their mid-30s who have decided to treat themselves with something they've desired most of their lives. And finally, we have the over 50 crowd. These people may have had great-looking noses their whole lives, but are living proof that the nose seems to change with time, and they wish to regain what they once had. When rhinoplasty was introduced, the trend was for the signature nose. Providing the ideal nose, however, proved a difficult task to reproduce over and over again. Over the years, plastic surgeons gained tremendous experience. Rather than placing some form of the ideal cookie-cutter nose on everyone's face, the trend now is to provide the proper nose in harmony with the individual patient's face, the right nose for your face, rather than giving you someone else's. We're speaking with board-certified plastic surgeon Dr. Zachary Gerut, who has a personal approach to rhinoplasties. Dr. Gerut, what is important to you and your patients who are seeking out these rhinoplasties?
Well, what's important to me in dealing with a patient before surgery of rhinoplasty is to be sure that attention is paid to both form and function. The nose should function properly after surgery, and the appearance of the nose should be what fits the patient's face, and usually that's exactly on the money with what the patient wants it to look like. My idea of a good-looking nose after surgery is, according to my best quotation I can come up with, like a good toupee. People say, I've never seen a good toupee, and that's true. You don't see the good ones. Anybody who's had a good rhinoplasty, no one can tell, because it fits the face naturally.
Excellent point. Let's meet two people who wanted to improve their look with the help of Dr. Gerut by getting a nose that matched their face perfectly.
Meet George Trasusi and Carly Tishner. Both had their noses done, but for different reasons. George's motivation was primarily health-related,
The basic procedure was to fix a deviated septum.
while Carly had a more personal reason.
Ever since I was like little, let's say around like 10 or 11, I've always wanted one. I'd look in the mirror and I just wouldn't be happy with my appearance.
Dr. Gerut's individualistic approach and his use of photographs appealed to George and Carly.
I went to Dr. Gerut's office and he had the pictures, and this was the most exciting part because he like draws on the picture of your nose in black marker to the exact nose that you're going to have. Like it's amazing how he gets it so precise.
He never pressured me to take the next step whenever I wanted to speak with him about doing it or making the decision. He made himself available. He and his staff were very, very accessible and very helpful.
And how do they feel about their new look?
This is exactly what I wanted it to look like. And I'm really happy with the results.
I love them. It's my favorite thing. I'm so happy with it.
You know, that's pretty impressive. I see what you mean about having the right nose for the right person. It's really important.
It is.
Oftentimes you hear that maybe somebody wants to change their nose, but for a reason that would make it larger. Is that possible?
Oh, it's absolutely possible. There are many times when a portion of the nose should be made larger or the entire nose made larger. It can sometimes happen because patients have had surgery, and unfortunately the surgery was designed to remove more perhaps than should be removed, in which case the nose must be built up. Secondly, there are the instances where because of a patient's ethnic origin, it is desirable for the patient to have a different looking nose, and therefore material must be added to make the nose either more well-defined or whatever adverbs or adjectives you wish to use, but more definition to the nose rather than flat against the face.
Now, whether you're taking away or adding to, does it ever affect the breathing through the nose?
Well, I always tell patients that it's impossible to take the roof of a house and make the top and the side smaller and have as much storage room in the attic as you did before. Breathing through the nose can be looked at in a similar fashion, although most of the breathing is done through the nose low down rather than high up where you do remove a bump. Nevertheless, breathing can be affected by surgery, and I personally feel very strongly that the nose should function as well or better after my surgery compared to before, and a good deal of attention is paid to that. If we check around the world, every single animal that exists on the face of this earth and existed for the past millions of years had a nose, and if it weren't important, not every single animal would have one. Your nose does more for you than just allowing you to breathe through it and taste food. Your nose affects how well you sleep at night. It affects the efficiency of your heart and lung function. And anybody who is a runner knows that they cannot possibly run when their nose is stuffy. And that's why it's important.
Now, you're always hearing about new technologies and new devices and the latest, you name it. Does it matter if you're going to use something that's been around for a while, an older technique or a newer one? Is the latest always the greatest choice?
The most important thing to consider when a new technology is offered to you as a patient is whether or not it appears to be safe. The FDA usually takes care of that for us. But no, the newest isn't always the best. Certainly, many patients, when it comes to something that should be as conservative as surgery, would rather have a time-proven treatment rather than something that has been media-driven for people to think that, oh, it must be wonderful because the magazine or the news show said so. Companies that manufacture new medical devices spend quite a bit of money on public relations campaigns so that the consumer will seek that new treatment out. But that doesn't mean it's better. When patients say to me, I heard that this new laser treatment or any treatment will last for 25 years, I answer, that's interesting. We've only known about it for 2 years. So it's important to be sure that you're having something done that is at least somewhat proven to be effective, not just new.
Okay. Quickly, what should someone search for when looking for a plastic surgeon? It's
important that the surgeon be board certified in plastic surgery or in the field regarding that part of the body they're going to have surgery on. The dermatologists and ear, nose, and throat doctors are very often board certified to do the procedures that they do. It's important to check the doctor's credentials with a local hospital to be sure the doctor can perform that particular operation in the hospital as well as in his office. And it's important to get a good recommendation from a physician that you know and trust or from a friend that you know and trust.
What do you like most about your job?
I very much enjoy making people happy. Plastic surgery or cosmetic plastic surgery is one of the few fields where everybody who walks in the door has the potential to walk out better than when they came in. It's really a pleasure to do that for people. You can change their whole lives by giving them more self-confidence, and certainly more of a better feeling about themselves.
Okay, great. We have to go to a break, but we'll be right back with more MDTV Medical News Now right after this.